So my case I'm putting is that phaco vitrectomy should be done and should always be done by a single surgeon. So phaco vitrectomy is now in vogue because it reduces the need of two sequential surgeries. It provides a clear media for the vitrectomy for the surgeon to operate. There's no chance of lens touch if you want, and the comfort and convenience for the patient. So what are the perceived advantages of using two surgeons for one phaco and one vitrectomy? That it brings two experts in two separate fields to give the best of the results to patients. So in terms of low intraoperative complications, gives better vitrectomy settings, and low complications leads to better outcome for cataract surgery. There is no wasting of energy. Second argument is given is that there is no wastage of energy for the vitreoretinal surgeon in doing phaco, and he can give his 100% attention to the vitrectomy surgery. So now, to understand why these are perceived advantages, we have to know why there are two surgeons came into first. Because phaco vitrectomy first started around 10-15 years back, and it coincided with the advent of the small gauge vitrectomy, which gives the advantage of sutureless surgery totally complete sutureless surgery pack. In those times, the senior experienced vitreoretinal surgeons had no exposure to the phaco during their trainings, and phaco training was restricted to the main centers, and they probably may have had some ego issues and adjustment issues to learn phaco emulsification from the start. Now, how I will debunk these perceived advantages that two experts in two separate fields give the best of the results. So most of us are now getting trained in cataract phaco surgery in the postgraduate studies itself. So we are well acquainted with the phaco surgery, and the majority of vitreoretinal surgeons are now increasingly operating cataract cases, pure cataract cases with phaco emulsification and oil and IOL. So they are now well versed with the phaco. They can operate it without causing any complications, without giving good results for the phaco itself. And the second point is there is no wasting of energy for vitreoretinal surgeon in the phaco. So really, you are talking about a case of 10-15 minutes surgery, maybe 30 minutes, 25 minutes maximum. Is it that really extra surgical time for a vitreoretinal surgeon who are used to do surgeries for 2 hours, 1 to 2 hours, sometimes 3 hours? I don't think so. Now, what I will put out for the advantage for the single surgeons are there is no need to coordinate. There is no management issues. You don't have to take appointment time from the phaco surgeon, wait for him to come. You don't have to waste time in interchanging, taking over from him and starting your surgery. And it takes some time to get into the surgery. So it overall takes a lot of time out of your OT time. When you do as a one surgeon, both surgeries become one integrated seamless surgery. You transit from phaco directly into vitrectomy. Then you go at the end of the surgery, you can again go back to the AC, wash the vitreous, adjust the lens if you want, and come out. So you don't, it becomes one total surgery and not two separate surgeries done at one time. You know your incisions, the strength and weakness of those points of surgery, your phaco incisions and your side ports. And so you can plan well with the vitrectomy incisions where you want to put your trocars. And you can do the same with your phaco incisions. So your phaco surgeon doesn't know that, and he will put where he feels it okay for him to put his incision. And sometimes you want to place a trocar even before starting the phaco surgery, so that there is nothing coming out when you put pressure on the trocar. So that can also be done. Now the phaco surgeon has just one goal: safe phaco and IOL implantation. Beyond that, he doesn't want to maintain the clarity of the IOL or pupillary size. Now, VR surgeon is more careful about the corneal clarity because he has to go in and operate, do some ILM peelings or some base excisions. So he is very more careful about the corneal clarity issues than the phaco surgeon. And any issues with IOL decentration happening during the vitrectomy can be effectively dealt with the same surgeon at the end, and you don't have to call him again back for this thing or giving a final AC wash. So this is just a small video which I have forward without editing, without cutting anything. You can see we have started the surgery. It's going fast. Well, just forward it. Just you can see in 11 minutes, I'm done with the Phaco. Directly, I can go with the trocar, put the trocar in. I'll put my chandelier in. And in 14 minutes, I'm ready to go for vitrectomy. So, and out of all, nothing you can beat this is the economic advantage. You don't have to share the cost with anyone. Everything is yours. So just think yourself, if you can do one surgery, you can do both. It just needs a mind to preparation, that's all. Thank you.